Hi everybody, Dr. Gerard here, and today I want to take a deep dive into discussing two serious low back problems, disc herniation and disc degeneration, specifically at L4-5, L5-S1. This is where the majority of low back problems occur. In fact, 95% occur at L5-S1. So first, let me help you understand how discs function so we can help you with your condition if you have this condition. So basically, we see a healthy disc here, and the discs act as shock absorbers. They're small shock absorbers to keep the vertebrae separate from putting pressure on the nerve root. This disc obviously is not in good shape. This disc has herniated, protruded, and it's pushing into the nerve root, which could easily cause pain down into the leg. This can be excruciating. And so when you look at a side view, we've heard the term slip disc. That's really not accurate. A disc can't slip out of place like a cookie or something because it's embedded. The disc is actually embedded into the bone with these Sharpie fibers. But in the posterior section, there's an inherent weakness where the disc can actually herniate, protrude, bulge out into the space where the nerve root is. And that can cause very significant pain and discomfort. When you look at a cross section, this is the inner red is the nucleus pulposus, and that's the squishy part. There's no nerve endings in here. It acts as a mechanical shock absorber. It's about 80% water. And then around the nucleus pulposus are annular rings, fibrotic kind of tissue. So that's healthy, and this one is not healthy. You can see how we've developed some cracks and fissures in the annular rings, allowing this inner nucleus to protrude out. When it does that, when it tears through these fibers, there's a leakage of inflammatory substances that cause pain. The annular rings do have innervation. They have nerve endings, and so that protrusion can actually reach to the spinal nerve root, and that's when it typically goes down the leg. And now we see a full prolapse where this is actually extruded all the way out to where it is right on the nerve root. When you look at an axial view, you can see that this substance is gone through these fibers, and you see how these fibers are torn, but that can heal. The body knows how to heal, and so we have a special technique we use for that. I'll discuss that in a minute. When you look at a side view of this disc material and this L5-S1, you can actually see the herniation putting pressure on the spinal cord itself. This person is in a world of hurt, and I sympathize. I've been there myself. And then the levels above, this also is a bulge disc, and a bulge disc here at 3-4 and 4-5. And also look how this disc looks white. That's healthier. It has quite a bit of water content, as it should. These two look very gray and kind of chewed up. These two discs are not healthy, and they've actually degenerated to the point where they herniated. So that brings me to degeneration. A normal healthy disc does not herniate. It can't occur randomly and spontaneously. Many people will say, oh, I just bent down to pick up the soap in the shower and bam, leg pain. They did not have that herniate overnight. It has been coming on over a period of months and years, in fact. So when we have disc degeneration, it has to do with lack of proper motion and alignment in the spine. So here's normal. Here's a good-looking spine with healthy-looking discs. Here we've progressed to stage 2. Maybe there's been some traumas or injuries, and the discs aren't as vibrant as they once were. And then if motion isn't restored and alignment isn't restored, stage 2 will progress to 3, and you can see here where there are bone spurs forming as the body tries its best to strengthen and shore up this injured area. And if stage 3 isn't stopped or controlled, it will march on to stage 4 where there's actually fusion of the vertebrae. And so these are the stages of degeneration that occur with the spine that is not moving properly. What happens when you have this herniation or bulge is that it puts pressure on the nerve, and that can go down the leg. The sciatic nerve is down the back of the leg. Other nerves are down the side of the leg or to the groin. But if you have pressure against L4-5 or L5-S1, most likely, it will go down the back of the leg, and that can be excruciating as well. So what do we do about this? In our office, first of all, we analyze the posture to look at how the curves are. There's natural curves that give you great shock absorbing. Do you have a balanced curve, or do you have too much curve in the low back, too much curve in the mid back, a flat back? Postural distortions are very indicative of a problem that you're developing or could develop a problem with the functioning of the discs. Here's a scoliosis that can cause uneven wear and tear over a period of years. So what to do? We use specific techniques, Chiropractic Biophysics and Cox Flexion-Distraction technique for these disc problems, degeneration and herniation. We do an in-depth analysis of x-rays to see where the misalignment are, so we know how to correct them. We use CBP, Chiropractic Biophysics, with specific adjustments to optimally align the spine, and then Cox Flexion-Distraction almost always is the game changer. We do this specific technique that decompresses, unjams, mobilizes, and adjusts the lower back. It's painless, and it often restores function so that you can get your life back. I hope this information helps you with disc degeneration or herniation if you're having those problems. Have a great day.